your question. Right. So if you have read and understood, considering its surgical and augmentation, kindly tell me, what are you looking at in picture A? Can you tell me which bone is it?
Picture is this is the left. Picture A is the dorsal surface, and picture B is the subscapular
Costal
surface.
surface of the left scapula.
Costal surface, sorry.
Of
Yes,
the left
yes.
scapula. You have to say this, dorsal and the costal, A and B. Okay.
Costal.
If you can please identify number 2 for me.
Number 2 is the acromion process.
Okay. Can you please
Yes,
identify 15 in picture A?
15 is the supraspinous fossa.
Okay. And then if you can identify number 5.
Number 5 is the infraspinous fossa.
Okay. If we come here to picture B, if you can identify 11.
This is the subscapular fossa or subscapular surface.
Yeah, fossa, that's more likely. Okay, can you tell me how shoulder girdle is formed?
Shoulder girdle is formed by the joint between glenoid cavity of scapula and head of the humerus.
Is that all? We'll come back to that later. Okay, can you please tell me if you can identify, yes, if you can identify, have I missed something in between? No. Okay, if what are this that you're looking at?
Number 6, ma'am.
If you can identify number 1, please, to begin with.
Number 1.
First of all, tell me what kind of image are you looking at?
This is an MR arthrogram of left shoulder, I guess.
All right. No guessing. Be sure. Okay, what is number 1, please?
Number 1 is the coracoid process.
Acromion. Okay. If you can identify number 4.
Acromion process. Number 4 is the clavicle.
Clavicle, right. Number 6.
Number 6 is the
glenoid cavity.
Glenoidal labrum.
Cavity. Okay. 5, please.
5 is deltoid.
Okay. Can you tell me the origin and insertion of deltoid muscle?
Deltoid muscle originates from lateral part of the clavicle, acromion process, along with the spine of scapula.
What is the nerve supply of the?
Gets inserted in the deltoid tuberosity.
Okay. Can you tell me what are the muscles?
Axillary nerve.
Axillary nerve. Okay. Can you please tell me what are the muscles which form rotator cuff? What are the muscles? which are called
Yes, ma'am.
rotator cuff
Rotator
muscles?
is formed by super. There are four muscles. Consists of subscapularis, supraspinatus, infraspinatus, and teres minor.
Okay, please tell me the origin and insertion of teres minor muscle.
Teres minor muscle originates from the lateral margin of scapula and inserts on the posterior aspect of greater tuberosity of humerus.
This muscle is supplied by which nerve?
This is supplied by axillary nerve.
Okay. Can you please tell me what are the structures which are attached to coracoid process? Which one is coracoid process here in the images that you are looking at?
Coracoid process is number 3.
Very good. So now tell me the structures, both ligaments and muscles, which are attached here.
Yes, ma'am. The ligaments that are attached here are coracoclavicular ligament, coracohumeral ligament, and coracoacromial
Acromial, yes.
acromial ligament.
Yes, and the muscles?
Muscles. Yes, ma'am. There are 3 muscles attached here. The insertion of pectoralis minor, and the
Yes.
origin of coracobrachialis, and short head of biceps muscle.
Biceps muscle. Okay, you said short head. How many heads biceps muscle has?
Biceps muscle has 2 heads, short
Yes.
head and long head.
Okay. Why do they call short head and long head? Where does the tendon of long head, yes, lies?
Yes, ma'am.
Where does the tendon of long head of biceps brachialis lies? In the groove. Which groove? Bicipital groove.
Bicipital groove.
In between which 2 muscles? If you can quickly tell me.
In between pectoralis major and
Latissimus dorsi.
latissimus dorsi. Yes.
Okay. Can you please tell me this MR arthrogram you identified correctly? Can you tell me the indications or what are the conditions when you ask for this investigation?
Ma'am, when I have to see the structures of the structures around the shoulder joint, like
Yes.
glenoid cavity or glenoid labrum, the ligaments and capsule,
Yes.
and the surrounding muscles, I
Yes.
can do an
Because of
arthrogram.
yes. Okay. Can you tell me what are the factors which decrease the stability of the shoulder joint?
What are the, sorry, ma'am?
What are the factors which decrease the stability of the shoulder joint?
What are the structures? Ma'am, there are some features which actually decrease the stability of shoulder joint, like the shallow glenoid cavity.
Yes.
And the legs capsule.
Yes.
Surrounding the joint.
Yes.
And there is lack of support inferiorly due to the presence of quadrangular space.
What is quadrangular space? If you can tell me the boundaries and what passes through it.
This quadrangular space is bounded medially by long head of triceps.
Yes.
Laterally by lateral head of triceps. Above by teres minor and below by teres major.
And what are the contents?
This space, through this space, radial nerve and
radial.
Axillary nerve and posterior circumflex humeral artery.
Vessels.
Vessels passes.
Yes. Okay, good. Thank you.